Medication. As a care worker, you will probably know that the subject of medication is very complex and that there has been much publicity regarding medication management in the care sector. Some of the highlighted issues include storing medication insecurely, storing medicines at the wrong temperature, individuals receiving the wrong medication, and inappropriate handling of medication by untrained staff. It is essential that you know what your responsibilities are, and your training should include a basic knowledge of how medicines are used and how to recognize and deal with problems in their use. It should also include the principles behind all aspects of the organization's policies on medicines handling and record keeping, legislation and guidelines which impact on the management of medication. There are numerous acts and guidelines which, to a greater or lesser extent, impact on the management of medication. Some of these are listed below. The Medicines Act 1968 plus amendments. Misuse of Drugs Act 1971, Controlled Drugs, plus amendments. Health and Safety at Work Act 1974. COSH Regulations 1999. Royal Pharmaceutical Guidelines and Care Standards Act 2000. Receipt, storage and administration of medicines. This list of legislation and guidance is given as an example and, of course, is subject to change. The organization that you work for will have many policies in place, and part of your training will include understanding the principles behind all aspects of the organization's policy on medicines handling and records. The policies that relate to medication specifically could include safe handling of medication, administration of medication records, storage of medication, disposal of medication, clear audit trails, a policy that includes and clearly states that staff are not allowed to take any medication prescribed for or belonging to a service user or the organization, and a written policy that details the action to be taken if a medication administration error is identified.